Most randomized trials on minimally invasive cholecystectomy have been conducted with standard 3 or 4 port laparoscopic or open cholecystectomy serving as the control group. However, there exists a dearth of head-to-head trials that directly compare different MIS techniques for cholecystectomy, for example, sills versus needle. Hence, it remains largely unknown how the different MIS cholecystectomy techniques fare up against one another.
To minimize selection and confounding biases, only randomized controlled trials were considered for inclusion. Perioperative outcomes were compared using a frequentist network meta-analysis, and interpretation of results were driven by treatment effects and surfaced under the cumulative ranking curve value, or SUCRA for short. 96 eligible RCTs comprising 11,083 patients were identified. Against all approaches, mini-laparotomy was associated with the shortest operative time. Meanwhile, needlescopic cholecystectomy was associated with the lowest rates of wound infection and the shortest length of hospital stay and post-operative pain scores. Risk of intra-abdominal infection, bowel duct injury, bowel leak, and open conversion did not differ significantly between all approaches.
In this study, we found that perioperative outcomes differed across MIS techniques, and in some instances afforded superior outcomes compared to standard laparoscopic cholecystectomy. These findings suggest that there may be equipoise for further exploring the utility of novel MIS techniques and potentially incorporating them into the general surgery training curriculum.